remind you about what we're talking about when you show your mother or whatever, okay? And in general, the way these ultrasounds are made is it's if you took the mother and the baby, everybody in here, like a loaf of bread, and then just took a slice of it, and then just took out one slice at a time. And in general, anything that's dark like this is fluid filled. So this is the amniotic cavity in which the baby's bebopping around. And then this is liquid blood inside the baby's heart. You can see the kid's heart beating right there. So this would be a slice, if you will, right down through the baby's chest. You see that little round thing? And that's the heart inside the chest there. So the kid's obviously laying sideways here. So if we turn it sideways right from there, ta-da! Sure enough, here's the little fetus in here. And this is almost a perfect picture. I mean, this is like what you're supposed to see in the textbooks and all, but see the beauty of the kid, especially when you've been so worried. You know, here's the rumpus bumpus end of the kid, the belly. Here's the chin here, nose, forehead. Kid's kind of looking up like that, you see. And now I'll take that off, and that's just a slice right down the middle of the baby, you see. And then if you look over here on this other side, you can actually see the extremities. So here's the lower extremity. Here's one leg, knee, lower leg, little tootsie sticking out here. Okay. And then there's the other one. Here's the other leg here. Leg, knee, foreleg, little tootsie sticking up there. And on this particular screen, exactly what you see is the exact size of the baby. So the baby is that big.
Still can't eat a whole chocolate.
That's right.
See?
And here's the navel cord of the baby coming in here, and there's a kid wiggling, you see. Here's the baby's heart beating again. And I'm going to tap the kid a little bit. Sometimes when you do that, that shakes them up and they'll move around a little bit.
Wow.
See what I mean? You see what I'm saying about, I mean, this is so cool when they're, you know, when you've been so worried about the baby and, you know. And so I'll just hold the transducer still, and there's the kid going absolutely nuts solo. Isn't that great?
It's excellent.
Isn't that neat? Yeah. So we're getting with the program here now, Mom. Look at this. We're doing some backflips and all sorts of stuff. And you're laughing. That really gets the thing jolly. Look, when the kid's going, look, stop, Mommy. There's a finger wave going, stop, stop. Look at that. See, here's a hand up here. Look here. This is great. There's a little hand waving at Mama going, please stop laughing. You're really jolting me, darling. Look at the kid. You got the kid stirred up now. Look at this. Another little hand. So you got, look at the little hands going, Isn't that spectacular? See why I like this one? It's great.
Awesome.
It's uncommon for me to see, you know, most of the patients that come see me are like between 15 20 weeks, so we'll do this is so fun. This is fun for me, and I'll do the measurement jazz on your baby here in a minute. In fact, I'll do that while you're watching.
You said that's just pretty much actual size.
Yeah, see, this is the crown rump length that we use to measure gestational age right there, the crown to the rump, and then while the kid's bebopping on that one side, crown rump length here is 5.5 centimeters, which is 12 weeks and 2 days.
So I'm 12 weeks pregnant?
Well, based on the average here, we'll measure this several times.
And this picture on the left that's just being still, is that just something that you took earlier and just stopped there?
It's just frozen. See, I can stop the one on the right too.
I see.
Just freeze frame it. And we can,
so he's moving even now.
And we can measure it. See now, I get about the same measurement, so this is fairly accurate.
Would you call that a sonometer?
Centimeter, centimeter, whatever. Yeah. So that's about 2 inches long, 2.54 centimeters in an inch. Isn't that cool? Let's stop and see if this is on there. Direct your attention here. These are called body cursors that just indicate which slice through the mother we're making, okay? And you can see on this one we're like side to side, and so I'm horizontal in your tummy here. And then here's your bladder here, and then we're up above there, and then we're into the amniotic cavity here, and here's the kid's head, and then the feet up here a little bit. And then you see this area here. And then all this white homogeneous area is the afterbirth here, okay? But then you look up here and you see what kind of looks like another sac here. See this little area here? So we'll come back to that in a minute. Again, you see kids' heart fluttering, kids waving, having a great time. Now on the picture on the left, you can see we're straight up and down over your pubic bone, okay? So the orientation here is a slice straight up and down, and then that orientation is towards the right of the screen would be down on the mother. So this is your bladder here, and then up is up and down is towards your back. So we're kind of into the kid here, again transverse through the baby. And then this is the placenta. Here's a little bit of the umbilical cord out front, just kind of floating in a bag of water there. And now I'm going to look over to your left a little bit. And I see what looks like another sac here. And we look back to the right, and this is all this one kid's sac here. And then it looks like you have a little bit of it here too, you see. And then you have to kind of think, now what may that represent? Well, you kind of look up here and you kind of go, well, there's a little thickening here. It kind of looks like a placenta. See that little deal there? But it's not nearly as big, nearly as prominent. Maybe it's a little fibroid on the wall of your uterus or something. But what it might be is a little degenerating placenta where you might have been pregnant with twins, and this might be one of the sacs here. And then you lost one of the twins, you see. And now we'll never know that. Will not, and the confusing factor is that in the bag of water, there's actually a bag inside of a bag. So sometimes if you do get a little bleeding between one of the bags, it'll show up as a little separation there. So I don't see any fetus in there, like a little tiny embryo that might have died or something, you know, although there's a little thickening right there. And so what I would bet is that you were pregnant with twins. This represents a little resorbed twin here, and then this is the sac that's going away, and then all this bleeding will continue to spot and will go away, and this baby will be here.
That's kind of
I don't really know that for sure, you see, but that would make sense. And
someone
almost
already suggested that we'd have triplets.
really, and almost in all of those cases, everything's fine. You see, it's just it's kind of a worrisome condition. And the kids waving and having a great time here and stuff. Anything else y'all want to look at? Indicates that it's recording now, so we'll test it for a little bit and see how we're doing with that little piece of tape over that punch out place. So again, we'll just start by getting oriented here. These are the body cursors, and I may have mentioned these before, that just indicate where on the mother we're doing the slices for doing the ultrasound. So we're obviously straight up and down over your pubic bone. The orientation there would be to the right of the screen is down towards the mother's feet. So in anything that's liquid is dark. So this is your urinary bladder here with liquid in it. And then here's the amniotic fluid, and here's the baby head first in here right now. Up is towards the front of your abdomen, and down is towards your back, and then here's baby's head. And then this white homogeneous area is the afterbirth or placenta, all this area coming way up here. And now I'm going to look over to the left and see, it looks like the baby's kind of laying a little bit over towards your left, Teresa. And here's heart beating, liquid blood in the baby's heart here. And then here's the youngster's spine, here a little bit of a spine, and ribs in here. And we'll look back towards your right here a little bit. And that area that we saw before, you remember that I was concerned maybe like a little partial sac or resorbing pregnancy or something. I don't see any sign of that at all. You remember what we saw down in front there, that little place that I said was either a fibroid or maybe a little piece of the placenta. It's all gone now. I don't see. So I would bet that you had a twin pregnancy where it's all resorbed now, gone away. That doesn't increase your risk for anything or whatever. Okay, now you haven't had any spot bleeding or anything, you said? Okay. Now, you'll notice that I've turned the body cursors horizontally now, and what I'm going to do is direct y'all's attention right in this area here. I've turned the body cursor, or turned the transducer horizontally, and I'm going to tap a little bit on your right side like I did a minute ago just to get oriented. So this is the right of the mother when we're going side by side. So we're going to go way south. Here's your pubic bone, and then here again your urinary bladder with urine in it. Then almost immediately we're into the baby. Kid's head first here, and then posterior placenta. And you can see on the body cursor we're moving up fairly high on your tummy now. And then all this area back here is the afterbirth or placenta. Here's a little tootsie right here. Let me see that.
Mm-hmm.
Now we need to measure leg bone, and so I'll go ahead, since the baby's cooperating pretty nicely for that, I'll go ahead and get that. Here's one leg, knee, and then the foreleg, and then the little foot crossed right here. And then let's see where the other leg is. It's all stretched out. No, it's up here. So you have leg up, and then knee, and then foreleg down this way. So looks like you have two complete lower extremities. Now the kid's kind of extended them a little bit now, so this would be one knee, forefoot, and then the kid just rolled over towards us a little bit. So here's the rear end of the youngster. And let's see if I can get where I need to measure here. So your baby's being pretty cooperative here for this measurement of the femur area. So I'm going to go ahead and take these measurements and then stop and make sure we're recording on the tape and everything. I like to try to measure the femur several times. The baby can turn just a little bit, and we'll get, it's real important to get the entire length of it in there. We do it several times until we kind of make sure that I'm trying to get the whole thing. I have to push on you a little bit harder. Are you doing okay?
Yeah.
Kind of shake them a little bit, and they'll move a little bit. Yeah, I've really got the kiddo stirred up now.
What is that?
That's thigh bone or femur bone in the lower extremity. And we'll stop the tapes and make sure that we're recording for everyone. There's the exact size of the baby's foot right there. Right there to right there. Sometimes I'll put a little measure marker up here that the parents tell me it's helpful to have just for comparison, so that this is 1 inch true measure. On this screen it's a 1-for-1, but if you play it on your TV and it's this big, that still represents 1 inch, so that the baby's foot is, quite a bit less than 1 inch long. That would be normal. Now we're going to get right into the region of the stomach here. And you can see we've got this little area here, which is the stomach. Baby actually swallows this amniotic fluid. It goes through the esophagus and gets into the stomach there. And then up from there a little bit is baby's heart. And see if we can check the different chambers in the kid's heart here. That would be nice. And even though the heart is so small, you can see 1, 2, 3, 4 chambers in it. That looks, it's smaller than the tip of my little finger, but still that's kind of reassuring that looks good. Now we're going to go on up. Here's left eye, right eye, chin. Baby's kind of staring at you. And then I'll just kind of pull on up in this direction here. Try to get into the region where I need to measure this youngster's head. Kind of tap the kid a little bit. Sometimes they'll move just a tiny bit like that, and we'll get a much better picture. So, and again, exactly what you see on this screen is the exact size of the baby. And the picture on the right is a cross-section through the baby's head, and the picture on the left is a cross-section through the baby's abdomen. And the normal relationship there is the abdomen should still be smaller than the head for quite a few more weeks during fetal life. And then we're doing the head circumference on the right there. Kind of get an average here for you. So that you're like 15 weeks in one day by the first scan that I did, and your dates and all, and this really is right on, perfect for that. Real nice, a nice symmetrical growth of then all the parts of the baby. Then what I like to do now is to again try to visualize the baby's spine. You remember we did that before, but it's so tiny that it wasn't quite as prominent. Now you can actually see the different vertebral bodies as separate things, and what we like to do is start up, and your baby's really very cooperative, start here at the base of the neck where it's normally a bit wider, and then as it gets into the thoracic region you can see these are ribs in here, it gets a little bit closer together, and then as we get further down it tends to get closer and closer together, which is normal. You don't get the whole spine in the same picture because the kids usually weave and indulge in a little bit, so we try to make like what I call a composite picture by just kind of going from one place to another, see if we can get a little bit closer. This is the hip area here in the baby. Here's the baby's bladder with urine in it. Remember I said anything with liquid. Here's stomach, and then while we've been sitting here, the baby has accumulated some fluid in his or her bladder. And just like all of us, they're working on the water department as well. Okay. And then here's upper arm, elbow, hand wave for daddy here, and then a little bit of loop of umbilical cord here. And again, here's the femur area. And maybe just wiggled a little bit again there. Well, it's a lot more personality as they get bigger, aren't they? I mean, each phase I think is enjoyable to see the kids when they're looking good like this. It's fun for me to, you know, you have kind of a special opportunity here that Lod don't, because you got a little tiny one, but now this is quite a bit bigger. Here's the other arm that we kept having trouble seeing. See, it's right up in front here and kind of down by the shoulder there. Left eye, right eye, front of the face. Here's the mouth of the baby. So then I think this looks good. Now, this looking good in combination with the blood screening test, the alpha-fetoprotein test, if it's normal, then that would pretty much exclude any kind of open spine problem in the baby.
Is that the one where you go in with a needle?
No, you're getting that confused. We do amniocentesis, and that's when we do the needle business on this fluid. That's for high-risk patients, and so then we do measure alpha-fetoprotein on that. But for most patients, we would just do the blood screening test, and unless you were at high risk for some particular concern. See the hand up there? Both hands out front there. Well, your kid is showing off pretty fancy here. almost identical view as you had before. And I'll just go ahead and measure. Remember we did the crown rump length last time? And it was, actually I can look on the graph here before and see the chart from before. That was 5.5 centimeters, so you're another 1.5 inches longer.
Okay.
All right. With this, we've done it 4 or 5 times. Well, see, here's the baby's heart beating right here. And anything that's liquid is dark, so this is the amniotic cavity in which the baby's bebopping around. Here's liquid in the baby's urinary bladder, fetal bladder here. And we'll stop the tape there, and I just want to stop here.
But I can see her perfectly. And her hands and feet.
Does, when you start feeling the baby move, does that mean that it's strong enough to kick real good, or does that mean it's big enough? Or both?
It just means it's big enough to kick hard enough where you can feel it from the inside, because before you could actually feel the baby move. The kid's been moving all over the place, so it's just not big enough for you to feel it yet. Alright, now we'll again direct our attention here. These are body cursors. Remember, they remind us where the slice is made for the ultrasound. This one's straight up and down above your pubic bone. And then again, to the right of the screen is down on mom. Up is up, down is towards your back. Okay, so here's the baby's head. And now here we go. This is the baby's heart beating here. Again, this is the placenta, all this area up here. I'm going to look over to the left, see if we see anything over there. Don't see anything there. Look back to the right to see the south end of the baby over there. Here's a little piece of spine here, kind of cutting through there. Now we'll stop, turn the body cursors horizontally for a minute, and let you look right up here again. And as we're scanning, this over here will be to the mom's right, so you can see me putting pressure there, okay? We're going to go way south. Here's your pubic bone, and here's your urinary bladder. Then we're out of that, then we're into the baby's head. So the baby's head first. Right now, here's the right eye and left eye. Right about here, nice 4-chambered view through the baby's heart. That looks real nice. And then a little further south, we're into abdomen. Here's stomach, and right about here is where I need to measure abdomen. And you can see navel cord coming in here, and I don't see any anti-abdominal wall abnormality there. That looks good. Sometimes it's hard to see there. Okay,
Well, I'm
so
not sure what I'm
a little
looking at
problem. This is a cross section through the belly of the baby. So this is the back. This is the spine here. And this round thing is the abdomen.
Oh, okay.
Okay. So this is the front of the kid's abdomen, and this little thing here is where the navel cord comes into the baby. And then a little further south, here's the baby's urinary bladder. Okay. Now we're going to come right over here and come right over the top of the kid's head. And again, exactly what you see is exact size, 1 for 1 for what we're looking at. And I don't see any signs of any problem in there, which is good. Okay?
Is this the brain right here?
Well, I'll show you here in a minute. Excuse me. All this area in here is all brain tissue. All of this, okay? Okay, so the picture on the right is a cross-section through the kid's head. The picture on the left is a cross-section through the abdomen, and I don't see anything that makes me scared or anything right now at all, okay? Everything I see is looking real good. I'm going to stop the tape. And then we'll slip down, excuse me, slip down this way into the lower hip bone area and look at the thigh bone again. Remember, this is femur bone in the lower extremity. And the kid's growing along a perfect profile for as far as long as you are, so that's good. Here's the legs all extended. Here's one leg, thigh bone, little foot coming down here. Here's the shoulder here. Shoulder, elbow, forearm, little hand right there. Again, placenta here. Here's the other leg all stretched out here. Coming up here, and then the foreleg there, and the little tootsie. So the feet are up alongside the head here. And then, see, where's the other arm? Here's the other elbow, forearm, little hand up there. So we got complete upper and lower extremities and all. Okay, so that's good. Of course, we knew that from before. Now let's go again and image the spine, starting right at the base of the skull. And I'm going to make this look real, make the bones look real strong just for a minute, make them look real white. Okay, so here's the south end of this kiddo, way down by the hip area, and we like to see this, as I probably mentioned before, this little bit of a sacral curve coming in here like this.
You remember on the last ultrasound you stopped and saw something weird? Have you seen that?
No, I haven't. Much everything I'm seeing here is looking real good today. And here's kind of starting up at the base of the kid's kind of like that, you see. And here's the spine coming in here like this. I really think that looks real good. I don't see any problems, and I don't see any sign of any fluid accumulation in the baby's head. About 2/3 of babies that have spinal closure abnormality will have hydrocephalus, or fluid buildup inside the head. I don't see any of that at all. And that's some of the clues. Sometimes we'll see that real early. So that's good that we're not seeing that for your baby. Alright. So, I think we should just do your amnio. Okay. And in terms of your amnio and all, then what we do, try to find a place like over here where there's no baby, no placenta, and just be a very clear place to come right in there, and the kid's like way over there on that other side, so we're in good shape. So I think it's very safe. Okay. Alright.
Are you doing the amniocentesis?
I do the whole deal.
Oh, okie dokie.
Yeah, Sandy will do the ultrasound part of it while I'm doing the needle business, and we kind of work together on that. So, yeah, this sort of one-stop shopping. You just, Robbie does everything, except Linda does the counting and stuff today. So, here's a kid's head. That looks real good, really. Real pleased with the way that all looks.
That he hasn't moved at all that I've noticed while you're doing this. Not that I felt.
Well, there's good movement right there.
I don't feel that.
Well, good. You know, when your kid's rocking and rolling, he's not super active.
I never really felt mine were